بسم الله الرحمن الرحيم.
بسم الله الرحمن الرحيم الحمد لله وحده والصلاة والسلام على من لا نبي بعده. Assalamu alaikum wa rahmatullahi wa barakatuhu. On short notice, I appreciate that those viewers who are able to sign on and catch our live feed have joined us this evening. Part of the reason why we put this together is because of the fact that, I mean, the obvious fact of the coronavirus and the COVID-19 really sort of occupying our lives, coming to our homes, our communities, our masajid, and so it's really the thing that's on everybody's mind. And I'll speak for myself. I know that I had a lot of questions myself. And yeah, despite being a mental health professional, I'm not a primary healthcare professional or an epidemiologist by any stretch of the imagination. And so I was reaching out to others to try to get more information. I reached out to, we had several text exchanges with Mawlana Bilal, with Dr. Fahad, with our staff here. We're having a lot of questions, trying to figure out what do we do? How do we understand what's going on? And so I thought, you know what, why don't we assemble a group of us to come together to really have a roundtable to discuss a lot of the things that are on people's minds. And so there were three elements of the of this sort of craze that's going on that I figured would be that's sort of coming up. One of it is like the healthcare, the medical aspect of it. What is it? What are the symptoms, the signs, the prognosis? What's going on? What's the future of this? Who is vulnerable? Who's not? Who can be infected? Who can't be? And then there's the aspect of it which is psychological, right? And that's the aspect of this fear and contagion of fear and panic that's been really going around. It's really hard to find toilet paper, right? In most places in the country, I can say that I went out shopping myself for some, despite the fact that it's not fard to use it, right? Um, and um, and then there's the spiritual dimensions of it. The How do we as Muslims respond to it? Do we go to Jummah? Do we not go to Jummah? What are the a'mal that we're supposed to be doing? The religious kind of litanies and actions and rituals that we should be practicing. Are there precedents in the lives of the companions in the life of the Prophet sallallahu alaihi wasallam? How do we make sense of this? And what do we do about it as Muslims? Is this a divine punishment? Is this a blessing in disguise? So all of these questions really arise, and I thought we should really have an interdisciplinary group of us come together to have this exchange. And so on my right, we have Mawlana Bilal, who's sits on the chair of the board of directors at Khalil Center, as well as the head of the Department of Hadith Studies at Dar al-Qasim, and my teacher as well at Dar al-Qasim. We have Dr. Aasim Padela, who's an emergency medicine physician. He's also the head of the Initiative on Islam and Medicine at the University of Chicago. And he's a bioethicist, and he's joined us. And we have Dr. Samar Harfi, who's our very own psychologist here at Khalil Center, who's also joined us to help us unravel some of the layers of the psychology of some of this together. So I want to start off just by asking each of you what your experience with this whole thing has been. I mean, on the one hand, we're all, healthcare providers or spiritual leaders that we have, positions of authority and leadership where we have to kind of care for others. But then there's also the real human aspect of it behind the scenes. And while we're trying to, come out on a Friday evening, I imagine that throughout the course of the day, we're trying to juggle our own lives and try to figure out how we tackle this crisis at the same time. So if we start with yourself, I know that I heard that you were maybe possibly going to be in social isolation today. Or
Yeah, I mean, the uncertainty that has sort of emerged in the last 2-3 days is quite surprising. But I think it's very encouraging to see that there was mobilization of religious authorities, physicians. There were quick conversations and quick turnaround in terms of producing documents and also sending out messages to the community as to how to cope with, Thursday morning the discussion starts. By Thursday night, messages are being sent to the messages as well, to recommendations are being made. So that was very positive, and it seems like we're preemptively trying to address the question. But I think that the nature of the virus, the disease, as well as the fact that ta'un, or general affliction type of diseases like this, we haven't experienced in our lifetime, right? I haven't. I don't know if I've ever experienced anything of this nature in my life, and I think even my parents' generation may not have experienced some of it in their lives as well. So to see something like this, the advantage is that it's gotten me to open up books I don't think I would have opened up otherwise, including texts on ta'un and waba, and defining the differences between various terms that are used, which we can't really easily translate into a particular type of plague or disease, infectious disease,
pandemic,
all these types of terms. And so it's opening up, I think, a lot of new discussions, and I think that it's important to admit that many of the people who are handling the issue are still trying to figure things out as they go along, and it's a very fluid situation. And as things change, perspectives might change, recommendations and might change as well.
Right, and I think that's the part of it that's sort of scary about it, is that it is an ever-changing process. And I think what you spoke to is the fact that it sort of hit much closer to home than we would have realized, and it just happened so quickly that I think it was sort of beyond belief for many of us, including myself. Dr. Aasim, what about yourself?
Well, so I'm an ER physician at the University of Chicago. First, I want to say, may Allah bless you and all those people who are gathered here, and may Allah protect everybody at home. So for me, the first relationship is always as a physician, right? So I fully expect, our department has been thinking about how we take care of patients that will be coming with questions of having coronavirus, or actually who will have coronavirus, right? How is our hospital going to be ready for the influx of patients? We've had a lot of policies, for example, in my hospital around canceling of classes, right? So there's classes I teach, canceling of classes, doing online things. So the first relationship to this was in a professional capacity as how we're going to deal with it as a physician, then how's my university dealing with it. And just to be honest with you, kids have spring break. I was supposed to go to Malaysia, and there was this conversation, and I was going to bring my parents and my in-laws, and the conversation was, well, should we go? Shouldn't we go? What do you think? And every day for the last 30 days, I'm looking at WHO reports. Where is it? Can we go? Can we not go? And if you're in a leadership authority, or you're someone who knows something about medicine, I can imagine many physicians here, everybody in your circle is texting you. Yeah. What should I tell my kids? Should I go to school? Should they not go to school? So for me, it was the same thing that almost every physician, I'm sure, who's watching has had that conversation, that all of a sudden you have to develop your expertise in what this is or isn't, even if it's not your field. And then also just today, there's this question, and alhamdulillah, we're as constant a community. People in Tonomi say, joke is Chicago Sharif. More muftis in Chicago than many Muslim countries in the Middle East. But then everybody, muftis are asking, if there's a medical issue, how do we relate this in a legal sense or religious sense? So I'll just stop there. But I think that for me, in this conversation, is, hit home. Right? Kids going to go to school, do I go on vacation? What's the protocol at the hospital? And then how is our community dealing with it? I think that all of us are enmeshed in these different conversations. And I congratulate you for having a conversation amongst us to think about that, because it's not just as one part of our life, but all parts of our life are being affected by a potentiality which became an actuality.
Yeah. Oftentimes as community providers and leaders, we tend to deal with issues that we maybe never have seen a lot or haven't hit us. And especially as a psychologist, I'm sure you could relate this idea of empathizing with a lot of things that we may never experience in our lives. Inshallah, Allah protect us all. But then you have this scenario where you have to care for others around this issue while you're having to deal with it firsthand on your own as well. So I think that's sort of what you're speaking to while taking care of others, taking care of self. Dr. Samar, what about yourself? What was this experience like for you?
Alhamdulillah, I mean, at first I think a lot of it was very cognitive, like all the information, listening to, what people are sharing through media, contacting me on the WhatsApp groups, information about it. But I think emotionally, I felt it. I think the other day I was at a major bulk grocery store, and it was just another day I was going there to grocery shop, and I think seeing everybody with like panicked faces, looking and talking about the things that they want to buy that they can't find, and just the empty aisles, I started to emotionally feel like my heart rate started to go up. I started to feel a little bit anxious, and then I paused and realized, like, even if I'm a mental health professional and I'm aware of the impact, I'm not immune to it.
Right.
So I kind of took a moment to just pause and rebalance myself and align myself, spiritually, how do I think about this? Emotionally, how do I think about this? And just kind of ground myself. What are the basic, small, practical steps I'm taking? But I think that moment I started to feel like that a little bit of the anxiety that people around me were experiencing.
Yeah, and it sounds like you were also trying to stock up a little bit there.
Find the Clorox.
One of the interesting experiences was that last night, because there were a lot of physicians that mobilized as well, and there was a lot of communication amongst the physicians as to what recommendations that they would make, independent of what the masjids and the institutions and larger umbrella organizations were deciding. And they were commenting on how we need to be patient, and a couple of them expressed their appreciation for like the ulama on the 29th of Sha'ban. And like, oh, is this what you experience every Ramadan? It's exactly this mass communication. You open your phone and there's 150 messages waiting for you to read, and discussions taking place, and people waiting for decisions. And it's a very interesting kind of experience. But what I thought was really unique this time, for this particular incident, was that there was a lot of collaborative, work, and there was a lot of discussion taking place across specializations, and I think that will continue, and I think it's a very healthy, it's a positive in a bad situation.
Right.
Yeah.
Alhamdulillah. I mean, in fact, the idea that we've all sort of gathered here as interdisciplinary, across different areas and specialties to address a common problem that's afflicting all of us, and in particular trying to respond to the needs of our community. Inshallah, the part of the khair is that it's bringing people together in tough times to kind of try to, tackle a tough issue.
If not physically, perhaps intellectually, right?
Yeah.
Social distancing.
Right. And as academics, we have a tendency to sort of intellectualize our, and to kind of stay away from the emotional part of what might be going on here to it's sort of an avoidant coping mechanism. Dr. Aasim, can we start with just some basic information about what is this? I think there's a lot of information going on out there, and we've all become kind of social media junkies. If we weren't before, then we've become that way, especially as we're, getting stuck at home and not leaving. So we're looking at, trying to connect with the outside world, trying to get as much information about this as possible. And so that's leading to, sleeplessness, like confusion, information overload, feeling overwhelmed. Can you speak to, can we just get a brief kind of synopsis and overview of what is this thing?
So I can give you an overview of what this is. I'll say with a caveat, I'm not an ID specialist, I'm an emergency medicine physician, and my information is also filtered through channels people have as physicians. So there's a general fund of knowledge we have, there's particularities, and so I don't want to speak to areas that I'm not expert in. And I'll also say, actually, I'm going to give some props, I guess, because people sometimes don't trust our medical authorities, but I think Dr. Anthony Fauci has done an amazing job. Like, just to be honest with you, in communicating with the public, raising issues with the policymakers, and those sorts of individuals, I think, should be prized, whether they're from our community or not, who are able to communicate in a very simple way to the population. So with that, I'll say, so I think you should follow his YouTube messages or whatever from the CDC.
Can you repeat his name?
Anthony Fauci, he's the director of the National Institute of Allergy Diseases in DC. So coronavirus, right, is a part of a family. There's a family of viruses, coronaviruses, right, that are part of the same family, which we get the common cold from. The challenge here for us is that this is a virus that is different from ones we've seen before. There's questions, and we're not going to get the theology of mutation and evolution here, but it's a question of how it arose, where it came from. WHO sort of thought that maybe this came from animals, right? Like the swine flu did. They mutated and then started infecting human beings. Things are still not fully known, right? This is data that's new. But for us, the problem is that it became something that globalized, right? So you heard that it's now a pandemic. And what that really means is the fact that there's increased incidence of community transmission, right? So while this started in Wuhan, Hubei province, that was people related to that were getting infected. Now we have community transmission in the United States where there's no connection to that initial area, right? And if you have that in one area, fine. But if you have it globally in many different countries, then the WHO calls it a pandemic, and that's what we're having. So in Chicago, right, we're concerned.
By community transmission, you mean to say that it's not being imported over anymore, but the fact that it's entered the community by members giving it to other members within the
two different things.
Is that what you mean by that?
So two things. One is, it's not imported from somewhere else. The other is we don't know, we can't connect the dots to that locale, but people have obtained it. Got it. So you could say, if we quarantine, so this is why the idea, okay, let's not have any travel, we have a travel ban from China, which the United States did early on, right? Because, okay, maybe all the cases were there if we couldn't stop people from coming from there here, but now you're having community transmission, meaning we can't actually trace how they got it. So Chicago has had, in my own hospital, we had the first case today, University of Chicago. And I think there's like 29 or 30, maybe now it's 50 cases in greater Illinois that we're worried about. In the United States,
up from 11, right? A couple of days ago.
Right, so I'll talk about the growth curve in a second, but there's like over 1,600 cases in the United States. There's been, I think, over 40, 50 deaths. Globally, we're talking about hundreds of thousands of people and thousands of deaths. So this is, I think the context becomes, right, pandemic, it's interestingly enough, it's a cold type illness, but we are calling it influenza-like illness. So it's not the flu, but for most people, they understand what the flu is, right? You have a fever, cough, respiratory symptoms, muscle aches. So for the common population, you think about it that way as a flu-like illness, although it's different from the flu, and has a different mortality rate and all these sorts of things. So I'll just say that this is something that you will imagine to be like the flu with fever, cough, symptoms, runny nose. Those are the symptoms. And the idea of the curve, since you brought this up, I'm sure all the social media judges are watching this know about flattening the curve and all this other stuff. But that all these measures, which some might say are draconian or overkill, are because we are now at the exponential part of the curve, right?
I see.
That there was one case, I think the first case in the United States in January.
Okay.
First case in China was in December.
Yeah.
Right, then it became 50,000, 100,000. So in the United States, we had one case in January. We're now in March, and over the last 2-3 weeks, it's been 150, 70, 100. Every day you get more cases. So we're now at the part of the curve that's going to go up very quickly.
Okay.
And this is the
how long? That's the question. I think.
How long is it going to last? But the fact is, and Dr. Fauci said this, right? That the fact is that there are going to be hundreds to thousands of people who are going to get this disease, and the capacity of the United States. I want to stop for a second, but we have to recognize that we are not like other countries, and that we're not testing everybody. So the true prevalence of the disease in the community, we don't know. But we do know that we have community transmission. People can't trace back to China. Therefore, it's here. It's already here. Containment won't work. We got to figure out how to manage and mitigate what's here, so that, as everybody's saying, flatten the curve, so that we don't have a huge peak of deaths that overtask the capacity of healthcare systems to deal with it. I can talk more about that, but I just think for a general fund of knowledge, we should recognize that it's a flu-like illness. It has similar symptomatology. It's different in its mortality rate. But the people who are at risk from flu you think about, they are similarly at risk for this. And the last thing I'll say is that two things, right? We should recognize that there's no vaccine. So part of the reason why flu, although it is harmful, people die every year, there's a vaccine for the flu that, at least for some people, we think about herd immunity. Some people think about reduces the illness length. There's no such thing. And it's not like a pneumonia, that you get bacterial pneumonia that I can treat you with antibiotics. We have no treatment. So the only thing that's left are public health measures, right? And to be honest, we actually don't have a natural history yet. That's why we're saying it's like Italy or China, because this is just not even 5 months old.
Right.
So are we saying there's no vaccine yet, or there's no possibility? Because my impression that there is a possibility of a vaccine.
Yes. So I think those are questions that specialists in that area who develop my R&D specialists would say. The communication from our healthcare leaders in the United States is that if at best we're thinking months, right, maybe years before we do that, I can tell you as a researcher, right, taking a drug to market is years. Vaccine development is not easy. We're talking about vaccine for malaria for decades. Perhaps this is different, but we shouldn't hope for a quick fix, right? Which is why all these things have happened all of a sudden. That, oh yeah, we're going to have a vaccine tomorrow. And even if you had one, can you get it out to everybody?
Right.
Yeah. So I don't think we should count on that at any point.
I think part of what you're saying is that there's this exponential growth and this huge question mark because we don't know who's carrying it, who's not. It's out there, and we're not testing enough. So for all intents and purposes, it sounds to me like we have an underreporting, right, currently, or underdiagnosis and confirmation of these cases, which creates, I think, contributes to the alarm. No vaccine. We're on the exponential growth. We don't know how long that's going to last for. Some people are going as far as I've heard saying that, everybody's eventually going to get it at some point because of the mass transmission, and there's no symptoms before, the first 5 days or so, up to 5 days, or even 14 days, you might be symptom free, but you're a carrier and you're passing it on. So
let me speak to two things about that. One, that's also the really interesting thing here is that you're infectious before you have symptoms, so you might not know. Which, as you said, that's just how the disease works. That's how the virus works. So that's different from other viruses, right? So it could be here. Even if you had the test, you might not want to go get the test because you didn't think I was sick, right? Right. Yeah. I mean, if you think about this, is subhanAllah, it's so amazing how every part of this is so interestingly different. That leads to all these things that we haven't seen before in our lives. Right. Because, right, other diseases, you screen people with certain symptomatology. Here, we don't even know. And then if you don't know, you're not going to go get even if you had a test.
Right.
And the opposite end, you can get ill and be fine and feel, hey, I have no fever in 24 hours. I'm not coughing. But you still might be shedding the virus.
Yeah.
Right? So we were talking about 14-day quarantines, like they're telling us in the healthcare, right? If you travel anywhere, make sure you have coverage for, this is why I said, coverage for your shifts for the next 2 weeks. Why? Because you don't want to come back because we can't even tell you if you're not infectious, right?
I see.
The reason that seems so odd is because, you could be feeling well, not have a fever, but if you were sick with this disease, you still could be shedding it, right? And people won't know.
Right.
So the 2-week period, after that 2-week period.
So Anthony Fauci said this, right? So interestingly, he said, well, the only way we can certify that you don't have the disease is 2 negative tests in 24 hours, right? Because we would actually have to say, okay, you're not infectious by a specific test, right?
Yes, I see.
Right?
You have to have something to compare it against.
No. Okay. Because we need to know the proof of that.
I see.
Because this is what I'm saying, this is a new disease. We can assume that you're not infectious, but to say that you don't have that virus in your body, we would have to do a biological test to test that, right? And 2 of them, because one might be, right? Might be okay, might not. Every test is 99 point whatever %. So this is what I'm saying. This is such an interesting, I shouldn't say interesting. For intellectually, right? Intellectually, it's interesting. But I think the characteristics of the disease make all these people are telling you, right, that you should worry. You should worry. But I think there's a fine line between worrying and being alarmist. And I think you guys can speak to that, right? There's worrying, being credible risk, thinking about these things, being careful, to then being in panic, suffering from anxiety, being alarmist, and that only, psychologically and spiritually is, I think, harmful for us as a community.
Yeah, could you speak to the psychology of this? I think that you're sort of alluding to this a contagion of fear, and it sounds to me like it's from what Dr. Aasim is saying is that it is a very real fear and threat. It's not imagined. There's so much we don't know about it, and we're not finding enough reassurance even in our healthcare professionals because they're caught off guard by it because of all of the features that you described. That there's so much. This is so much of an anomaly from what we've seen before that there is reason to be scared, and there isn't much reassurance that we're finding. And so, we kind of feel like we're out of control here, and so what do? We, go to like grocery stores and and stock up. Can you help kind of speak to this fear aspect of it?
Absolutely, and I think there's a lot of focus on how contagious the virus is. I think a lot of people aren't paying attention to how contagious the emotions and the anxiety and the fear is. Like I mentioned, when I went to the store and I started to see people, I started to feel that fear that they were feeling. Fear contagion is actually a social psychology phenomenon where an emotion is spread from an individual or group of people to a larger community, and we're seeing it worldwide spreading, of course, with social media and people communicating and being touched. I think what's fueling this fear also is the uncertainty and the unpredictability of this virus. And when people are experiencing fear at high levels or are overwhelmed, their rational thinking goes down. So they start to do behaviors or actions that might not be rational in terms of protecting them from the virus.
Yeah.
Like going back, I know there's we're labeling the toilet paper phenomenon right now. Like people purchasing.
Or hand sanitizers.
Exactly. And I'm sure you'll speak to this, but we're not against being prepared. And it's normal to have this level of stress when we feel unsafe or insecure. Our body is wired to experience that fear and feel the insecurity in order to protect ourselves. But however, when we become alarmist and the fear is exaggerated or leading us to do behaviors that are not rationally helpful in terms of protecting us, that becomes a problem.
Yeah. Yeah. And there's that law of diminishing return, right? The sort of, your anxiety is healthy to a certain extent where it allows you to become prepared. But then once it, goes above that threshold, you have diminishing return. So you start to, have anxiety that isn't actually beneficial for you anymore, and it's having actually, and this is this piece where also our immune systems can become weakened by becoming overly stressed. Absolutely. And having this chronic long-term kind of stress as well.
So I think sleep patterns, right? People who already have predilection towards sort of anxiety become even more anxious, right? And as you mentioned, what we call ER, we can say mass hysteria, these sorts of things. But the other thing I think that's problematic, perhaps this is an opening for you, Mawlana and Bilal, but we then become in this perceived sense of fictitious control, right? So I'm going to do behaviors, I'm going to scrub everything down, I'm going to do this, I'm going to do that, and then God forbid, one of our relations, something happens in our circle, that myth of control shatters, and we have nothing to fall back on.
Yeah.
Right? There's another end to that, right? So so I think starting off with this notion that I can control, we have to be measured in our notions. Right. But if you become hyper, that I'm going to control everything and I can manage it, you're not preparing yourself at all for anything that might happen that's problematic, and then you're shattered, right?
Yeah, and that speaks directly to the spiritual health question. That I think if you look at, I think it's critical that Muslims approach the issue of any disease of this nature differently, based upon our theology, right? And that theology does revolve around this question of ikhtiyar, right? What we have choice, and admitting those things that are beyond our control. And this is definitely something that I think that the experts are telling us, is that we have to be able to release some of that need for control, and to be able to acknowledge that a lot of what's going to take place in the next few weeks, next few months is going to be beyond our control. And I think it's really interesting if you look at how, as early as the time of the companions, that was a question, right? Like, how much control do we have? And the qadr issue, or the destiny issue, came up in addressing probably one of the what we know as the first plague, or ta'un, or ta'un. I think Ibn Hajar Asqalani more defines it as just any widely spread disease, right? And that took place in Amawas, called ta'un Amawas, in which 25,000 people died.
Oh wow!
And it's really interesting about that ta'un is that
this was in the Khilafah.
This was according to some, it was the 17th year or 18th year of Hijri.
Okay.
Right. According to the historians, they differ as exactly what year it took place. But senior companions died in that, including Abu Ubaid ibn Jarrah, Mu'adh ibn Jabal, Shurahbil ibn Hasana, Yazid ibn Abi Sufyan, and others. And so there were like senior companions, even not just companions, but authorities and leaders. Abu Ubaidah was the same leader who was appointed by Umar ibn Khattab, who questioned Umar ibn Khattab's hesitancy to come to the area of the ta'un and said, Amir al-Mu'mineen, afirar min qadarillah, are you trying to escape the predestiny, right? What's destined, what Allah has destined for you.
That's very interesting.
And then Umar ibn Khattab radiallahu anhu reacted in kind of, in rebuke that this is coming from you, Abu Ubaidah, right? If only someone else had said this, he said, afiru min qadarillahi ila qadarillahi. I'm running from the qadr of Allah towards the qadr of Allah. And that essentially this decision to allow for a sort of a quarantine and to avoid entering the area in which that ta'un exists is also sort of within our control. And so he recognized after, of course, there was consultation that took place. And that's an interesting thing also to see, is that Umar ibn Khattab radiallahu anhu did not make that decision to enter into Sham, the area of Sham in which the disease had spread, until he had consulted with senior companions who were alive and who were going to accompany him. And their fear, right, that yes, if this is contagious enough that it gets to these companions who are accompanying you, we will lose our leadership, right? And then he had to ask the question as to whether or not this is within our control or not. And the answer that he came, the conclusion that he came to is that this is within our control, and we have to take action and err on the side of precaution. And certainly, it is possible that Umar ibn Khattab could have gone and avoided the disease, right? As a physician today, actually, my father was telling me that, very interestingly enough, trying to give people to avoid that alarmist sort of attitude. He was saying that there's no definitive relationship between disease and death. But not everybody who dies of disease, and not everybody who gets disease is going to die.
Right.
So you do need to kind of balance this idea that we're thinking that everyone who is afflicted with the disease is going to die, and so I think it's interesting that Abu Ubaidah passes away from that ta'un, right? But Ibn Hajar al-Asqalani actually in the 33 or so texts that deal with ta'un that I'm aware of, he titled his Badr al-Ma'un fi Fadl al-Ta'un.
Interesting.
And so he in sort of he calls it he titles it the virtues or the excellence of ta'un, right? And sort of taking like the positive spin on reframing it, exactly.
Yeah,
so he's saying that this is obviously an affliction, and the way he describes it, the panic and alarm is sort of contained within the definition of ta'un. That it's not just widespread a disease, and it's not an abnormal disease. It's not just widespread, but also something that you don't see customarily or conventionally in the community. But he also says that it's something that causes huzn and ham. He talks about the psychological effect of it. So, but then at the same time, he's talking about its relative virtues to some degree and how the people are to deal with that.
Yeah.
And I think that's really key, because if you look at throughout history, and I haven't studied the entire history of how Muslims dealt with ta'un, but it seems like there was an attempt to check that alarm and to recognize that if this is beyond our control, do whatever you can. And then leave, especially in this case where we don't even know who really is Marid. It's very hard to make decisions. When decisions are made, just appreciate that there's a lot of ambiguity there.
Can I just say something else? But so what's interesting, I'll say, and I don't think I mentioned this medically, but when I came home, my kid's school is closed now for next week, and one of my daughters, was saying that so this idea, okay, debrief what's going on. The kids obviously know something's going on. School's canceled next week. They're all worried about coronavirus, and I don't remember exactly what she said, but the idea was, okay, well, they're putting people on ventilators. People are going to die, right? And I was like, no, people aren't going to die. And she
Your daughter said this?
My daughter said this. She's like 10, and she threw a look to my wife like I'm just trying to make her feel okay. Like little kids, don't worry about it, right? No. 99 out of 100 people aren't going to die, right? And let's just be real. There are people who are higher risk of death, but this isn't like, because media has this sort of way, Ebola, people bleeding out, right? So what is going on in the mind of kids in their house, right? Am I not going to see my grandfather tomorrow? I'm not going to see my mother tomorrow, because once we get the disease in Chicago, they're all going to die. This is not a cogent, comprehensive, rationally thought about response, right? It affects us, but I think we should also be, what's the facts? What's the evidence here, right? This is not like that. Most people who get it are not going to inshallah, right, suffer mortality. You might get sick. You might be hurtful, right? But and I'm not saying you go and seek that. I'm just sort of saying you have to be measured in how you communicate about this, even within your own family, because you don't know. I mean, I didn't know my kids were thinking they're going to die tomorrow, right? Absolutely. But they could be thinking that.
Right, definitely. Right? And I think when we talk about even how to talk to kids about this, like there's a saying that kids listen with their eyes. So whatever you tell them, but they're going to watch, look at your reaction when you're talking to people. And I think when there's ambiguity, people pull into what information they have, like the images from the media. You know, when it's the apocalypse, people are running the stores and grabbing everything. Right. And people are just like having a knee-jerk reaction to act in these irrational ways.
Yeah. It sounds to me like there's almost like with the kids, they can see actually what's underneath our behaviors, right? And ultimately what we're, all frantic about is that we're coming face to face with death, right? The idea of death, at least. There's a sort of some, some psychological theories about how the Western countries tend to kind of try to shun the elderly, right? Because they represent death, and so we don't want to see that and to have to be reminded of death. So we kind of put them away. We don't put them on media or shows or billboards or whatnot, and put them in nursing homes and whatnot. That's another topic. Not saying that.
Don't visit nursing homes during this crisis, please. As a fellow professional, please don't go there. They're high risk. Call them. FaceTime. Don't
go. But there's that sense of the children are almost like seeing that and they're asking directly about it, whereas it may sort of rest in our subconscious and our attempt to try to kind of gain control. Mawlana, could you speak to? You were speaking about this issue. I kind of want, because it's an idea that's growing around a lot. This notion of control versus letting go of control, right? Like if you go to one side, then you're trying to exert too much control, and you said psychologically that's not going to be healthy, right? And then it also has physiological consequences, right? But then you can go to the other extreme, and people will say, this is some sort of CIA conspiracy, or it's I don't know, Chinese people eating all sorts of animals that are attempting to, somebody's trying to destroy the economy, or there's all sorts of notions, and I'm not going to let this bother me. I'm going to have tawakkul. Sahaba picked up a bottle and made a dua and like drank poison. So, right. So I'm going to Jummah, right? and I had I've had elderly clients who have come in, without hesitation, even though I thought they might prefer web therapy or something like that. And they're like, I'm going to Jummah, and so I think that's okay for them to kind of have that notion, and of course it's a personal decision for everybody. But at the same time, how do we understand what that fine line is? And I think, we can look at very extremes, but then the more subtle extremes is, I think, where the problem lies. And that's where I think we get into a lot of dispute about, are we erring too much on caution, and then are we, subjecting ourselves to too much risk?
Yeah. I think the word that you use, fine line, I mean, that's key. There is no fine line, right? And if someone is choosing to, I think there are certain extremes that are clear extremes, right? Denying the contagious nature of diseases is a misinterpretation, or it's a weak interpretation of a hadith, la adwa wa la tiyata fil Islam. And the vast majority of investigative scholars of hadith have clarified that this does not deny, this hadith, the Prophet ﷺ is not denying that these diseases are infectious and contagious, and that we shouldn't use preventative measures to prevent further contagion, and you should not go into a scenario where you are going to potentially, you're susceptible, especially if your immune system is compromised, or if you are yourself potentially showing symptoms. Going into that situation is actually responsible, and you could be ethically responsible for that. However, because it's not a fine line situation, a lot of people are healthy, they may be infected, but they appear to be healthy, and they feel like tawakkul is allowing them to just kind of function as normal. It's hard to say that that is also unethical, right? Because they don't appear to be sick, they don't appear to be creating spreading sickness, and until you can make that determination that someone is, this is how like sort of the fuqaha now are discussing this, is that how do we prevent people from coming to gatherings, which are part of sort of the spiritual element of health, which does also impact physiological health and mental health. How are we telling people they cannot come to those congregations without a clear demarcation of who is sick and who is not? And if we are testing and we can say, okay, someone is sick, then it's a simple answer. And if it's not, then we have to kind of realize that it's a gray area situation. There's no fine line.
And the thing that medically, I think that I'll say that we have to recognize the truth that this is a very changing situation hour by hour, day by day. But as I said, we know there's some community cases in Chicagoland, right? And we expect with the exponential growth that next week there'll be more, and the week after there'll be more. All right, and this might last several months, right? May Allah make it last shorter time. But even our efforts, right? I want us to understand, by social isolating, because the United States is a vast country, you might have pockets where there's still community transmission. They travel, right? And I mean, right? You can have this prolonged notion of what's happening. So when we make decisions today, we're actually thinking, forecasting things are going to happen 4, 5, 6, 10 weeks from now. But I'll say this. I'm not going to pick on the ulama. I mean, I think that the point here is that your point is valid, that we have to recognize there are certain things that people need to function normally. It's a normal response, right? And unfortunately, we don't have a great marker or test to say who's not or who isn't sick. But our response shouldn't immediately be that because then everything we have to shut down, right? Right? Everything needs to be shut down. We stay in our homes. That's what China did, right? United States won't tolerate that probably. But that's what they did, because they said there's no way to tell. We want everything shut down totally. That's what Italy is trying to do now. And it might come to that. But I'm just sort of saying, then there's no question about religious service or anything else, because this is now, right? Everybody has to quarantine totally.
And that's where the collaboration was key. We had a conversation last night, and one of the questions I think a lot of the scholars are having is that, okay, are we going to be able to, in 2-3 weeks, be able to test?
Right.
And once we test, then we can basically change our protocol. So we're just taking precautionary measures now, shutting down congregational prayer. In 2-3 weeks, we'll have clarity. And so that's where then, the physicians experts are telling us, well, no, we're not testing. We're not going to be testing, right? Or at that scale that you think that we're going to be able to test.
So today, I think, again, and I don't want to speak for what, I'll tell you my source, Dr. Fauci, right? And all these people saying, Trump, 5 million tests next week, right? What's the population of the United States? 230 million, right? Okay, say you get 50 million tests, right? Everybody who thinks they need a test will get a test. I mean, my point, and even our protocols, we're thinking about the hospital. Well, we're going to, right now, self-quarantine. If you have an influenza-like illness, it takes 24 hours to get this test positive. We'll tell you to self-quarantine. By that time, hopefully you haven't talked to 5,000 or 1,000 other people, right? But my point is this idea that we're going to do one-to-one testing and every case will be isolated, that's gone. That is not happening at any time soon, right? So to depend on something that we know, as I said, you can even have the test, but look at our population, getting them out. Every hospital, we function right now at 93%, 94% capacity. Right? So to say that now we're going to add on capacity to test everybody who wants to come through for drive, I mean, we're trying, but we're not set up for this idea that we're going to be one-to-one correlation of everybody who's sick and quarantine those people only and their relationships only, and then get the cultures back. This is not, I don't think. They might be able to get something happen, but that's not how we're preparing for this notion.
So how does a common person prepare for that or process that information? Because what does that mean for us? Does that mean that we, it's almost like a losing battle, or what's the point in all of this precaution if we can't predict any of this? We can probably get sick anyways. It's just so much. There isn't a whole lot of testing going along.
Yeah, I don't mean to say it's just. I think that things are changing on the ground rapidly. The normal path that we understand, and what they're saying is that exponential growth. Next week more cases. The week after more cases. The week after more cases. And we hope that in 8 weeks' time that we have less incidences. But we don't have a great sense. So let's just take the example of China. China, the first case in December. China still has cases today. The new cases today, right? We're not a 1 billion population.
Right.
We're not Italy with 16 million. We're not. We're 330 million people, right? There's a lot of business travel. There's a lot of things happening everywhere else, right? There's a lot of factors. So I think that each country is like what we say in the HSR, natural experiment.
Mm-hmm.
It's a natural experiment. What's going to happen? What things work? What didn't work? And they're all trying. And so we'll have to ride this out. So the religious ruling today, no Jum'ah say, okay, then I'm saying get prepared. What is your marker to then say that you're going to do Tarawih, which is not Fard? Or what's your marker that you're going to open it up 3 weeks from now? Are you saying that we're not doing Jum'ah for the next 3 months? Then let's just be real that we can maybe get some data, but and here's the best thing, like I'll say, maybe Seattle has a lot of communication now, right? And maybe South. So we know we can say Jum'ah based on fact, community prevalence is high, don't do it. Illinois had 2 cases, maybe, or whatever it was, right? I'm just saying that you're going to have to be consistent about what you do, and if you're going to start doing this, then let's do it en masse, right? And then figure out what the other strategies will be for what you just said. I mean, I can only imagine the 85-year-old who's never missed a Jum'ah, not Jum'ah, Ramadan Tarawih. You're going to like lock the doors and say you can't come in, right? I mean, I think we have to recognize that this is something that we're going to have to talk about, and we'll be catching up with data. We'll be catching up with recommendations by state authorities, and the ulama need to be savvy, right, about how we engage this through our own texts, and also not buy into mass fear and hysteria. And I'm going to end here for 1 second. Sorry, So when we were speaking, and Fahad's over there, Hafiz, so Allah subhanahu wa ta'ala says, He says, وَمَا أَصَابَكُم مِّن مُّصِيبَةٍ إِلَّا بِإِذْنِ اللَّهِ وَمَن يُؤْمِن بِاللَّهِ يَهْدِ قَلْبَهُ وَاللَّهُ عَلَىٰ كُلِّ شَيْءٍ قَدِيرٌ. Right? So nothing that befalls you happens without the leave of Allah subhanahu wa ta'ala. And the one, وَمَن يُؤْمِن بِاللَّهِ, the one who believes in Allah, يَهْدِ قَلْبَهِ. Now, you can translate Yahdi, but guides, gives support to, encapsulates, right? And then the verse is Allah ala kulli shay, and Allah is powerful, all powerful over all things. Yeah. So our texts are amazing. To say the first response to these bala and all these things are to think about how it's happening, what's happening, the qadr, right? So if you say, okay, no one pray, no one come to Jummah, and that one person that who is praying and his dua was accepted, and you have now caused them distress, which you could reasonably, or no one's praying anything. Because we're saying, well, worried about social media and social isolation and wiping out Clorox. Yeah. Man, like, Allah is in control of who's He going to turn to. I'm not saying go and be egregious, but don't forget this. This is our deen.
Yeah. I think
if I can add a point to that, is that we can appreciate that there's still ambiguity as to exactly what the origin of the disease is, but there's no ambiguity that it comes from Allah subhanahu wa ta'ala, right? And I think that answering that question is important because, like Shah Walillah in the Hujjatullah Baligha, he discusses the idea that mental health, and he connects mental health to the bohemian nature of human beings, and that if you feed that through what you eat and what you drink, you're only feeding sort of that animalistic, bestial element of the self, and that creates then physical health problems and spreads disease and also mental health issues and things like that. And there's definitely going to be a link. Your spiritual health is going to be affected by what you eat and things like that. But let's say that we don't trace it to any sort of wet market in Wuhan, right? and it's because of that, which it's really odd that it seemed like it could potentially be because of our hirs as a society, right? Because that in the communist era, hirs is like covetousness and our greed, because in the communist era they couldn't produce enough food, and so people started wildlife farming bears and strangeness of animals that you would think to eat, but it was because more of the monetary motivation that the government had sanctioned that, and they made that policy to legalize wildlife farming, and then that potentially now is being linked to the spread of not just the COVID-19 but other diseases. I mean, how does that link to potentially the question that people are asking? Is this part of Allah's wrath?
Right, right, exactly.
And there may be a link, right? And there's and very likely to be a link. Now, to answer the question that I'm sure a lot of people are asking is this an adhab from Allah? Well, it depends on who is afflicted, right? And Hafiz ibn Hajar, I think when he says that these ta'uns are an adhab upon the disbelieving nations or the previous nations, but it's a rahmah for ours.
A mercy.
And that speaks to the idea that the way that you respond to it is the actual answer to the question. Like, how do you respond to it? And our response needs to be spiritual, right? And so congregational prayer, as Mufti Taqi Usmani actually released some advice about this recently. He said that we have to ask that question very carefully. Are we going to prevent people from accessing one of the means of preventing this from spreading, which is Allah subhanahu wa ta'ala's wrath is because of the fact that so much greed. And that's why Shaykh Amin's recommendations, I think, is also we should probably address to. One of them is giving sadaqah. صدقة تطفئ غضب الرب. Extinguishes the wrath of Allah. Sacrificing an animal for the sake of Allah subhanahu wa ta'ala to avoid his wrath. Reciting Surah Yasin every day. And
which is the opposite automatic reaction,
exactly.
Which is go to the store and clean out and self-preservation and
exactly.
And it's almost opposite to the experience of survival and grief. This is going to the other extreme almost to regulate.
Yeah, exactly. But you have to speak positively. Like subhanallah, a lot of the awliya of our community, and usually I think a lot of the hidden awliya, which are the women of the community, without being told the wazifa by the mashayikh, they're already starting salat al-hajjah every day, 2 rakats. Mm-hmm. In fact, some of them thought they're doing salat al-istikhara because it's what's bringing khair into things. I mean, but they're like they have a natural response that we're going to deal with this in the way that we can, in which we have choice, we have ikhtiyar in this, right. We have choice. So they're dealing with it in this way. Now, it's interesting that in the Hanafi school, we don't consider congregational nafil prayers as sanctioned when it's invited. You invite towards it. But in other schools, one of the responses to and I saw this in books of the Shafi school, that one of the responses to widespread disease is congregational prayer. Mm-hmm. Just like with istisqa, when there's drought, and so I think adopting these means is really important. That regardless of whether or not it's from animals or from bats, or I think that we do need to ask this question: that how long are we going to prevent people, or even just distract them from really right now what we should be turning people's attention to, while we also appreciate the regulations, mm-hmm. and then come up with long-term strategies and forecasts. I don't think anyone's thinking about Ramadan. In fact, the first person to think about Ramadan and to ask the question about if we're going to stop the fara'id now, are we going to be stopping the nawafil in the nafil prayers in Ramadan? Dr. Aasim was the first to bring that up, because a lot of us are thinking just about tomorrow. Like, what happened this morning's Jummah, Right. And I think that's a very important question to ask, and that's why I think these procedures, these policies that we put into place, we do need to look at it as a long-term strategy.
So I was telling you, I don't want people online to think that we have some unitary. I just want to be caveat. Like the ulama, as you said, they're collaborating. They're using the best evidence they have. Ijtihad issue, they're deciding. And I think that people should follow the authorities that what they're telling you to do, and I don't think we're saying anything other than that. I just want to clarify. Then I'll also say what's beautiful, and I shared this with you before we went online. A friend of mine was telling me that he did Jummah at home with his kids. He's never had this opportunity to give a khutbah. She said this hadith, and they talk. I mean, look at the spiritual benefit. The kids were off from school, no school. They did a little Jummah in their house because they read somewhere they should do Jummah in their house. And so on, it was a time of coming together, thinking about Allah subhanahu wa ta'ala. I mean, these are benefits. Maybe Hajj said that in his book, I don't know. But again, there's so many blessings and amazing things that we can think about. We just have a moment to pause and not get up, right? Yeah. How can I make this beneficial for us, right?
I wanted to actually go to that point with you. The piece about, you guys are talking about sort of the communal aspect of this thing and regulation of Ramadan and, making sense of is this an adab or not, and punishment or whatnot. But, what do people do at home? Like if they're disconnected from their spiritual coping resources. I mean, given that we work here at Khalil Center, a lot of our clients that are coming here are oftentimes looking for some spiritual, making meaning out of spirituality. And if we're cutting a piece of that off for them, necessarily or not necessarily, Allah knows best, right? Then what can be done and what's happening? Like, can you speak to that, the importance of personal spirituality to the mental health aspect of it and that social isolation that we're sort of creating?
Absolutely. And as I was hearing you both discuss, I was thinking of this quote that a professor used to say, like, it's not either or, it's both and more. Mm-hmm. So it's not about moving forward with life as it is or isolating yourself completely. It's how can you capture that important support, spiritual support. And in Islam, we know that a lot of our spirituality is communal. There's a lot of communal. I was just thinking also, like, introverts probably have an advantage. The introvert's advantage. But subhanAllah, I think, like, trying to, like, the story that you shared was beautiful, like how they were able to transform it to a strength and have this family gathering. And I know this is a little bit different, but I was thinking about women who sometimes during Ramadan when they don't fast, they sometimes feel like a negative feeling of I'm not participating. And subhanAllah, it's decreed from Allah, and you're not supposed to fast or participate, but it challenges a woman to connect to Allah through different means. And I know this is a different experience for like men in the community
Yeah.
being prevented from a ibadah that is not just an obligation, but there's a lot of joy and benefit, like the 85-year-old person who goes to Taraweeh. Just knowing that, somebody once said, are we calling to Islam or are we calling to Allah? Those practices, I think, are an important part of Islam, but ultimately our goal is to be closer to Allah. Even is it an affliction, is it a punishment or a blessing?
Yeah.
Is it bringing you closer to Allah or pushing you further away? And, are you immersing more in the materialistic aspect of the world? But going back to how to cope with it, I think psychologically as well, I think one thing that I heard is action steps. What can you do?
Yeah, yeah.
So for children and for adults, being able to do something about a situation that's very uncertain and unpredictable brings a sense of security and comfort. So of course, modeling it as adults and also teaching it to children. Basic, even making things very simple and structured and routine. Routine also brings comfort. Small and consistent actions. So for example, wash your hands, get good sleep, make sure you're eating, try not to stress, like deep breathing.
And what do you suggest about the social media aspect? Like if people have to stay home with their families,
right, absolutely.
What should people be doing so that they can, they often say, like when you're enclosed in a room for a long period of time, you start to go crazy, so.
People are going to fight over chargers. No, but I think with social media and having time, I think one thing is to have one, when it comes to looking at information, having one reliable source of information. So the Center of Disease and Control or World Health Organization. So trying not to just openly search and have a specific time, let's say, preferably maybe not at night, maybe during the morning when you wake up, what's the updates, and just not go back so you're not stressing or feeding that anxiety. Keeping busy at home. So one thing I actually noted as a recommendation talking to children, because they're going to be home and have free time, teaching them the value of time, some time management, having them have basic goals during the day of, whether it's puzzles, some activities at home just to keep them busy so they're not filled by just, the fear of people around them or just wasting their time. And I think you had mentioned that a lot of children, or you might have mentioned, might have fear around like what's going to happen to the adults in our community or our grandparents. So I think something that helps is even with their teens tend to worry more about, what's going to happen to other people. Younger children start to worry, about themselves. So even having them contact their grandparents or people who are important in their community through Skype. And the goal ultimately is just to have a normalcy in their life.
Yeah.
There's a lot that's changing, and a lot of what's underlying the fear is, is death. Am I going to die? But also, is my life as I know it going to completely change?
Right. I know my children are facing some of that in the sense of, unlike myself growing up, they really enjoy going to school. so they were bummed out about the fact that they have to stay home. But the idea that we can't go anywhere and like the weather is getting really nice for us in Chicago, right? and they're sort of and speaking of grandparents, I mean, both sides, both grandmothers were going to come during spring break on different occasions, and they're out of town, right? They're in Canada, so they can't come, and we have to sort of break the news to them that. And they're like, well, this is going to be a really boring, like, spring break. And how long is this going to go on for, right? We can't do anything, right? And then, obviously, we don't want them watching, like, we don't want to get them on a screen the whole time just to kind of keep them busy. And then we run out of it, and we got to get online and start working from home while we have these children around. I think it proves a very different type of difficulty that we, how do we sort of turn that challenge into a strength? And maybe if you can answer very briefly, and we can have a few closing remarks, just because we're coming to the end of our time. Just some takeaways from each of you that we can close with.
Right. So I think you said the weather is getting better, so it's okay to actually go out. It's just avoiding crowded places. So I think something important is to maintain routine, engage in activities. Parents might need to be adults, whether they have kids or not, need to be a little bit more creative about what can we do without putting ourselves in a place, risking our health. So going out for walks, going to parks, practice, the basic practices of making sure you're washing your hands, not touching your face, but also it's okay to be out in nature. So Pella, like there's a lot of studies that show being out in nature help your brain self-regulate and calm yourself down.
Right.
So other than it being enjoyable, it can also help counter and fight the anxiety around this situation.
So I think I would say there's 2 points. One, I think I would suggest that we recognize that we have a responsibility to the community, and we have to turn to Allah subhanahu wa ta'ala, right? So some of our teachers is very interesting, and even Rasul in a sense used to do this, but like they were worried that people around them are being affected because of their own failings. Right? He says stuff on social media, Chinese people eat these bad things, that's where you got it, right? But actually, maybe this adab is coming not to you because of failures that you have had as you are a Muslim, and your responsibility is to make dua that Allah we're not trial for other people, that can I correct if I. This is the Muslim response, right? A theological response to look. This is affecting everybody around us. What did I do? What did I make istighfar? Do something. And I think that's the action-oriented steps that we need to do to recognize. And I think that we oftentimes get caught up in but this is the direct connection that you need to mend, right? For whatever reason, Allah is calling you back to Him. We must do that. That's one. Secondly, and I'll say this to my own ilk, right? My physician group, physicians, mashallah, in the Muslim community went into doctoring, right? The highly prized profession because we want to help people, educate them, take care of their health, right? And sometimes we find people fail, like diabetic person doesn't take their medicine, whatever. I think we have to recognize in the end that there is a spectrum of people out there, and we're not going to be able to fix everything, right? Meaning that our role here is to inform and engage, okay? But the ulama have a role to inform and engage. We have engage with each other, but we should be able to find, every Muslim should be able to find themselves within that spectrum. And a lot of times, unfortunately, what we end up doing is setting vitriol. This person's wrong, that person's right, this person this. And that musibah, right, this fitna, is what we're calling that. So I think that, okay, there's a lot of spectrum, people tell us a lot of things, we should educate, but we cannot at this time afford to start throwing, vitriol against other people in the communities, and saying that people shouldn't be doing this shit. I mean, you can recommend, but I think, and I'm saying that because physicians here, we really feel this is our role, this is our time. Right? I'm an ER doctor. I was made for this, right? Go to the ER, and everybody's dying, and I'm here with my.
Right.
But listen, this is to Allah subhanahu wa ta'ala. So don't overinflate your sense of importance or your control of these things, and let people find themselves within the deen of Allah subhanahu wa ta'ala and the recommendations as best that they can. Don't censure people for everything. And I'm not saying be careless, as you were saying, but don't take your role to tell everybody else is wrong, you're doing this wrong, you're doing this wrong, you're doing this wrong. It's not going to be.
It just kind of forces you to have a humbling experience, it sounds like. And to speak to, I don't know if you wanted to address any of this in your closing remark, but the idea of this diversity of approaches, right? Like we're getting, you're talking about physicians having different responses and recommendations and predictions, because it's such a new thing. There isn't sort of a consensus or a clear linear thing. I would joke with you guys, now you guys are psychologists, right? I mean, because we deal with non-linear problems a lot of times, right? That don't have a clear prediction or prognosis all the time. But also that we're seeing in the religious communities, right? Like ulama, different masajid are taking different approaches. Some people are opting to close, some people are not. And certainly I can hear some of the noise around it as to, these guys are like risking the safety of people, and then these guys don't have enough like iman or you see what I'm saying? Right. And there's that stuff being tossed around. And so how do we sort of, work within that environment to ensure that, we're not becoming distracted and, missing the forest for the trees in this whole entire experience?
I think if we appreciate that diversity exists, and it should exist, then you should simply follow your local authorities, right? Because the principle is to follow the wali, who has sovereign authority. In the absence of that, your local institutions are serving that function. We can appreciate that, and I almost predict that a lot of those messages will actually have reverse policies within a few weeks. The ones that actually will have opened up their doors will actually start closing them for reasons that would be justified, and the ones that were closing them eventually during a long time, they're going to start opening them up. And so I think a lot of that will become more clear over time. And I think this is important to have that sort of positive attitude and appreciate that there are going to be differences of opinions, even within amongst colleagues on issues. And there were a lot of diverse opinions that were expressed in certain bodies before they even came to a sort of a shared conclusion. The other thing is, I think that, and maybe just part of my closing remarks, is that I think that just as we're planning the schedules of our children and ourselves during this time, there's always a spiritual benefit of khalwa, sort of isolation, social isolation. and creating and maybe filling these gaps, these spiritual gaps where we're missing something, using this as an opportunity to start very specific walayif, litanies, and spiritual exercises on a daily basis. This is a perfect time.
Can you recommend any in
So
particular?
the first thing would be that every morning, Surah Yasin, right? And then we can do this with the family. The children can do this as well, and this would be a great time because it'll associate it with
Everybody's
difficulty.
at home. Yeah.
Everyone's at home. They can recite Surah Yasin. 2 rakat Salat al-Haja. And this can be done in congregations with children as well, right, if it needs to be done, although not with invitation in the Hanafi school. So it wouldn't be that type of situation. So you could do that as a family activity. The other thing is giving charity on a weekly basis and increasing it, right? And having the children participate in that as well, just so they can see that, whether it be an online donation or some other form. And the other thing was the sacrificing of an animal, whether it's be by sending it abroad or something like that. The other thing is in terms of daily practices, also in terms of du'as. Sheikh Mufti Muhammad Taqi Uthmani has been suggesting that a lot of abundant recitation of La ilaha illa anta subhanaka inni kuntu minadh dhalimin, which highlights our own dhulm element, as Dr. Aasim was talking about, that we're acknowledging that there's a lot of oppression that we're, as Sheikh Amin calls it, we're paving the way through our science, the Jannah path. Maybe this is part of that, and so we're doing dhulm upon ourselves. Ya Allah, if that's the case, a lot of this La ilaha illa anta subhanaka inni kuntu minadh dhalimin. And then he also was recommending Allahumma arfa' 'anna al-bala' wal-waba'. Allahumma arfa' 'anna al-bala' wal-waba', a more specific dua that Allah lift from us, from this community, the affliction, al-bala' wal-waba', this general widespread illness. And then he'd also recommended that as a habit that we make sure that children, when they leave the house or when we're leaving the house, we're leaving with that dua, Allahumma bismillahi la yadurru ma ismihi shay'un fil ardi wa la fis samai wa huwa as-sami'ul 'alim. Every time you leave the house, right? And then also in the name of Allah, that in His name nothing can harm in the heavens and the earth, and He is all hearing and all knowing, right? And He knows all of what's going on. And actually, that meaning is actually quite important to also to impart on our kids. And then he also recommended that we keep this up, that after every salah, ayatul kursi, which is a protection, right? And I do this with my daughter. I try to remind her when she goes to school every day in the morning to do this. But after every salah now, and if everyone is praying salah together at home, this is a good time to develop that habit. So maybe this is a positive that there's going to be a lot of like khalwa opportunities for 40-day jillas at home. You're going to have these spiritual experiences, and I think it's going to be a good precursor to Ramadan, inshallah, and no one really gets ill and is affected, and those who are ill and are affected, they only get good out of it, inshallah.
Is it for those who may not have memorized those du'as, is there a place where they can access that, or
so what I can do is I will send those du'as to the Khalil Center social media interns or whoever's in charge, and then they can post it on Facebook and Twitter.
In fact, if any of us had any sort of concrete recommendations, perhaps that could be something we could put together as just takeaways from this discussion, even if it's a one-pager, and we could send it out for individuals to benefit from, inshallah.
Just a couple of closing remarks. I wanted to say thank you for reminding us, and I love the dua, La ilaha illa ant subhanaka inni kuntu minadh dhalimin, the dua of Prophet Yunus, because it saved him from out of the stomach of a whale. So a very unpredictable, uncertain situation that you can't imagine a way out of.
Right.
But just kind of briefly wanted to say, so try to seek social support. It doesn't have to be in person, even through, on the phone, through being part of groups online. People who are struggling with mental health issues, anxiety or depression can likely be affected more deeply. So try to seek support. There's a lot of online support and services.
And Khalil Center is going online in some of our offices, but even the ones that are staying open, in particular Chicago and LA, we make available web therapy for those individuals who may get sick or who might be susceptible to sickness.
Right, and I just wanted to note the resource of the National Alliance of Mental Illness, NAMI. So they have a warm line. You can contact them. This is for non-crisis situations if you need emotional support. They also have contact information for 24/7 support if anybody needs any more additional.
And I think I would say that all of us, our parents probably were not going to be going shopping and stuff, so we're told, right? We should make sure people can get food. I mean, get home delivery, Kroger, whatever it is. There are many people who don't have this ability, and maybe you go stock up, but make sure they say the people around you can get food.
The elderly.
Yeah.
Absolutely.
Or feed each other in your households at least too, right? People are kind of close together for a long period of time. They would get on each other's nerves. So
Time to start baking with the kids.
it's like spouses start to like wonder when they can go back to work or their spouse leave the house. So, Mawlana, would you mind ending off with a dua?
So I end with the short dua, inshallah ta'ala. Well, our Sheikh, he used to finish every gathering with a very short dua, so I'm going to explain why it's very short. And that's that he would ask Allah subhanahu wa ta'ala, oh Allah, have mercy on us. The reason for that, everybody would come with any illness, any issue, he would give the same dua. Someone asked him, Sheikh, everybody comes with different problems, he gives them the same. Allah rahim farmai, Allah rahim farmai. So he explained it, and I think that's really interesting, the explanation. He said that what I see in the world, in the nature of this world, that when you've tried every means to get out of crime, right, and you've adopted every means, and you're now appealing to the judge, you make that final appeal. What is that final appeal? You just appeal for mercy. So I think that, inshallah ta'ala, this appeal for mercy that we draw from the mercy of Allah subhanahu wa ta'ala, Allahumma arhamna, Allahumma arham alayna, Allahumma shfi mardana wa marda muslimin. More importantly and most importantly, Allah subhanahu wa ta'ala, oh Allah, have mercy on us, have mercy on us, have mercy on us. Allahumma salli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad. كما صليت على إبراهيم وعلى آل إبراهيم إنك حميد مجيد اللهم بارك على محمد وعلى آل محمد كما باركت على إبراهيم وعلى آل إبراهيم إنك حميد مجيد اللهم اغفر وارحم وأنت خير الراحمين يا أرحم الراحمين يا أرحم الراحمين اللهم اغفر وارحم وأنت خير الراحمين اللهم اغفر وارحم وأنت خير الراحمين وصلي وسلم وبارك على محمد وعلى آله وصحبه أجمعين برحمتك يا أرحم الراحمين. And we finish by touching our faces.
Okay.
I do.
Yeah, thank you to all of the listeners, and I know that there may be many questions, but we advise you to kind of reach out to your local authorities to address any of those questions, or even to send emails to Khalil Center, or I'm not sure if you guys take email, not very much. We'll take the emails, inshallah, and we'll try to get you the appropriate responses if needed, or we'll direct you to resources. Assalamu alaikum wa rahmatullahi wa barakatuh.